Hello and welcome to our seminar on brain healthy living. I'm Dr. Diane Darby Beach, the gerontologist and director of education here at Vista Gardens Memory Care Community in Vista, California. Today we're going to be talking about how to keep your brain healthy. Can you do things to keep your brain healthy? Can you do things to reduce your risk of getting Alzheimer's or some other form of dementia? The answer is possibly yes. By the end of today's seminar, I would like you to understand what the 10 warning signs are of Alzheimer's disease so that you'll know what to look for. I'm also going to help you understand what you can do. There are 4 lifestyle factors that you can put in place today that can help you reduce your risk of having Alzheimer's or some other form of dementia. First, I'd like to start with a brief anatomy of the brain so that will help you understand what happens when Alzheimer's or other forms of dementia set in. The first part of the brain is the cerebrum. It fills up the bulk of your skull. It's in charge of remembering, problem solving, thinking and feeling. It also controls movement. The next part of your brain that we really want to consider is what we call the cerebellum. It sits at the back of your head beneath your cerebrum. It controls coordination and balance. The last part of your brain, probably the most important part, is what we call the brainstem. It connects your brain to your spinal cord, and it's in control of all your automatic functions like breathing, your heart rate, blood pressure, digestion. What happens when the plaques and tangles set in with Alzheimer's is those different parts of the brain are impacted. Everybody's different. Depending on where the plaques and tangles go for each individual will dictate what their symptoms will look like. We all have a right side of our brain and a left side of our brain. The right side of our brain alerts us to novelty, things that are new. It helps us understand the big picture. It's in charge of our musical, visual, and spatial capabilities, in charge of our emotions, our intuition, so it helps us maintain relationships. The left side of the brain, on the other hand, keeps us aware of time, sequence, and order. It's in charge of our auditory, our hearing, our receptive and verbal expressive strengths. It specializes in words, logic, analytical thinking. It also clearly delineates boundaries for us, helps us dictate what's right, what's wrong. So again, with Alzheimer's or other forms of dementia, depending where the impairment is, right side, left side, that's where the symptoms will be, we will be more aware of them. So what's the difference between dementia and Alzheimer's? The words are used interchangeably all the time. This is how I best explain it. If I was to say this is the umbrella term fruit, there are several types of fruit. There's apples, bananas, strawberries, blueberries, what have you. In the same way, dementia would be the umbrella, and there are several types of dementia. There's Parkinson's-related dementia. There's frontal temporal lobe dementia that just affects someone's frontal lobes. There's dementia with Lewy bodies. There's vascular dementia that happens if you've had a stroke or a series of smaller strokes. And then there's Alzheimer's disease. So blueberries are one type of fruit. Alzheimer's disease is just one type of dementia. The reason you hear about it most often is it's the most common form. It accounts for about 75% of all the cases of dementia. So let's move on and talk about the 10 warning signs. If somebody has 2 or 3 of these warning signs, then it's time for concern. I want you to remember, especially in the case of Alzheimer's disease type dementia, it's more than just memory. So if you're having some memory issues, it's not necessarily time to panic and think that you have Alzheimer's disease. When I go through these 10 warning signs, these symptoms, you will see that. Again, if you or somebody you love has 2 or 3 of these, then it's time to get in and see somebody and have a diagnosis made up. Recent memory loss that affects job skills. Perhaps you're still working or volunteering. You or your loved one can't keep doing those tasks. You're having difficulty. Difficulty performing familiar tasks. Maybe you've always balanced the checkbook. Maybe dad always did the gardening. And now they're having difficulty doing those things. Problems with language, word finding, can't follow a conversation. Poor or decreased judgment. Dad starts giving money away to telephone solicitors which is very uncharacteristic for him. Mom looks outside, it's a cool January day, but she dresses like she's going to the beach in July with a tank top and flip-flops. Problems with abstract thinking. Basically what abstract thinking means is we connect something that comes before and something that comes after, a cause and an effect. It allows us to think in hypotheticals and to reason. So if I said to my mother, Mom, please take your jacket, it's cold outside, or you might get cold. But if she's got dementia, she can't make those connections. So it's better I just pack the jacket for her. If she's going with other people, I send the jacket. I don't try to reason with her. Changes in mood or behavior. Changes in personality. You can see somebody who was described as being pretty easy to get along with become combative, even violent. And vice versa, someone who was very hard to get along with, it can become very sweet. And then lastly is just disorientation to time and place. Somebody with dementia will do something like this. I'm going to go out to the grocery store, should be a half an hour, 45-minute outing, and they're gone for 2 hours because they got lost. Okay? None of the landmarks made sense coming home, and they were just clearly lost. Okay, so in San Diego and Imperial counties, we have over 53,000 people who have this disease. Age is the biggest risk factor. 1 in 8 of us who reach the age of 65 will have Alzheimer's type dementia, and half of us that reach the age of 85 will have Alzheimer's type dementia. And that's just one form of dementia. That's not including vascular, Parkinson's, Lewy body, frontal temporal lobe, what have you. The bad news is that we are really, we're living longer. So depending on our perspective, is the glass half empty or is it half full? The half full perspective is we're outliving many cancers. We can treat hypertension, high cholesterol, and diabetes so people don't die of a fatal heart attack or stroke. We can even treat AIDS. It's still a terminal disease, but now it becomes chronic because people live with it a lot longer. All 3 of those things allow us to live a lot longer. Most of us have a very great likelihood of living very long. So, well, is that the good news or not? Because now we're more likely to live into our 80s, which gives us a 50-50 chance of having Alzheimer's type dementia. That 85 plus group is the fastest growing segment of our population in the United States and in San Diego. So, now that I've depressed you, what is the good news? The good news is there is a growing body of scientific literature that's showing we can actually reduce our risk of getting dementia. Now, these things aren't foolproof. You could do everything I tell you and still get dementia. The fact is there's a growing body of correlational research that's showing there is a relationship between these things and reducing your risk. And honestly, they're not going to hurt you unless you do things extreme, all right? I'm talking to you generally. I don't know your individual medical histories, so if there's any question at all, please contact your physician first. It's called the Brain Lifestyle Big Four, and here's what they are. Mental exercise, social connection, nutrition, and physical exercise. I want you to know that basically heart health equals brain health. The things that I will be talking about and advocating for have already been shown to be very heart healthy. Now we have research that shows they are equally brain healthy. Heart health equals brain health. That means control your blood pressure, control your cholesterol, monitor your diabetes, quit smoking. All of those things cause you to have less of a circulatory mechanism, which means you get less oxygen to your brain. For every pump of your heart, 25% of the blood goes straight to your brain. So if you have carotid arteries or restricted arteries or unmonitored diabetes or you're a smoker, you are losing that amount of blood each time, which means it's not rocket science to figure out you might have a problem with dementia later on. So monitor your numbers. First thing we're going to talk about is physical exercise. Why is physical exercise so good for your brain? Because again, you increase that oxygen uptake to your brain. Things like walking, running, dance class, yoga, meditation, weight training, exercise. If you don't already exercise, 2 tidbits here. Do something that you like and do something that's convenient. If you hate walking, do not make it your goal. You're going to walk 4 to 5 times a week because you're not going to do it. And if you make it your goal, you're going to go to the gym that's 15 miles away from where you live and 10 miles from where you work. You're not going to get there. So make it something you like, something that's convenient. Let me also say here, it doesn't have to be something that is super extraordinarily intense. I've done research, there's a body of research out there on exercise that shows a nice, leisurely walk is just as beneficial for your heart and brain as running, okay, or doing something more intense. If you like to run and like the higher intensity exercise, no problem. What I'm saying is you don't have to do that. All right, next lifestyle factor, nutrition. You really are what you eat. It's what your mother said to you. It's what your grandparents said to you. You really need to have a diet that's clean. And basically what I tell people is when you go to the grocery store, stay out of the inside aisles. What's on the inside aisles? Nothing but processed food or frozen food that's loaded with sugar and salt. If you think about what's on the exterior of your grocery store, it's your produce, your fruits and vegetables, your dairy, your meats, your grains. Stay on the outside. What is particularly good for your brain? Deep green leafy vegetables such as spinach, kale, Brussels sprouts, broccoli. The omega-3 fatty acids that you get in fish, in particular salmon, halibut, tuna, mackerel. You can also get it in flaxseed, walnuts, and pecans. Folic acid and vitamin B are really good for your brain. You get those in legumes, poultry, turkey, oats, beans, lentils. Vitamin C, it's a very good antioxidant for your heart and your brain. You can get those in prunes, blackberries, raspberries, blueberries, strawberries, oranges. Red grapes are better than green, and cherries. Vitamin E is also really good for your brain. You can get that in almonds, hazelnuts, and sunflower seeds. All right, what's the next lifestyle factor? Mental exercise. Your brain is a muscle. If you don't use it, you're gonna lose it. So, reading, writing, playing board games, jigsaw puzzles, Sudoku puzzles, whatever it is, and change it up. If you're already good at crossword puzzles in a particular newspaper or periodical, shift to another one. Stretch yourself a little bit. Your brain craves novelty. If you already read, but you only read romance novels, try something more technical, or vice versa. Your brain can grow new brain cells and new neurotransmitters when you do new things. All right, so the last lifestyle factor we're going to talk about is social connection. Wow, if you stay socially connected, you don't get dementia? Here's the catch. You don't have to be the big party goer, the big fundraiser. It's just a matter of not isolating, because when people get very isolated, they get depressed. When you get depressed, your self-esteem plummets, then you get more depressed, hence the less likely you want to be out and be social. So it is a vicious cycle. So stay connected, call an old friend, take a class, develop hobbies, but stay connected. So those are the lifestyle big four. Again, mental exercise, social connection, nutrition, and physical exercise. I hope this seminar has helped, and I cheer you on to a good life. These things will only increase your quality of life, will decrease your risk of getting dementia, and make you feel better. Thank you very much.